to know that in practice, many times we are unable to diagnose Kawasaki immediately, and many times 4 or 5 days are passed. So, are there any clues which we should be vigilant in the initial 4 or 5 days, so that we do not miss the diagnosis of Kawasaki disease?
Okay, that's a very interesting question. Having seen Kawasaki for nearly 2.5 decades, uh, the earliest I have made a diagnosis of Kawasaki has been 2 days. Day 3, we could make a diagnosis of Kawasaki and we were right. Of course, we started only on day 4. It's very difficult to make a diagnosis of Kawasaki in the first 3 to 4 days, particularly in older children. It's far easier to diagnose Kawasaki in infants and young children below 5 years. It is in older children that the diagnosis is often delayed. That is one. 2, it is always better for the same clinician to see from day 1. What will happen? Day 1 child might have fever and a little bit of red eye, and tongue may become red on day 2 or 3. There may be a node on day 4. And if it goes from one doctor to another, it goes on 6. The conjunctivitis may not be there. The lymph node also may not be there. So it can get missed. So this wide dispersal of symptoms always leads to delayed diagnosis. That is 1. 2, the more the age, the more is usually the delay in diagnosis. 3, you should not forget to see the perianal region and the BCG region. A child with fever who doesn't have diarrhea, who has perianal erythema, that is a significant clue to Kawasaki. And you should not wait for the echo to show abnormalities. In fact, it is your duty to treat Kawasaki before the echo becomes abnormal. And platelets go up only toward the end of the first week. In fact, many pediatrician friends of mine, they tell me, sir, platelets are normal. That doesn't rule out Kawasaki. A normal platelet count, a normal total count does not rule out Kawasaki. The other clues for Kawasaki include the presence of sterile pyuria, marked irritability, young infant. In fact, we have done lumbar puncture in a few infants who had irritability, and they may even show mildly elevated protein also. Aseptic meningitis can be part of Kawasaki. Last but not the least, they may come to you after 10 days. They may not have fever, but they may have peeling. We should not say everything is gone, go. It can be a medico-legal problem if you do not give the benefit of doubt of IVIG and aspirin to the child and follow it up periodically. So, the best way to diagnose is to have a high index of suspicion, and of course, ESR, CRP, counts, urine routine, decrease in albumin, increase in globulin, they can all be very good clues to Kawasaki.
Right. Thank you, sir. Thank you for emphasizing the point that the clinical features may happen in series and not in parallel. That is, the famous example given by some of our colleagues, where it is like palpating the, elephant by 5 blind men, everyone thinks of different things, and ultimately it turns out to be something different. And we have to be very, very vigilant, because we have only a small window to prevent that coronary artery complication. So one has to be very careful about this particular condition.